Peace be to you. This is Omar Abdul Malik, physician assistant and health educator. I want to do a quick video for you guys about being a hospitalist physician assistant. This is a relatively new position for PAs, meaning that it's been around for, I'd say, less than 10 years, so relatively new. I have been a physician assistant for 18 years now. More than 3 years of those have been as a hospitalist PA. It's markedly different from the work that I used to do as an outreach medicine. Hospitalist PA is it's a different kind of beast. It requires that you really have to know a lot more pathophysiology. You're not following your patients for years in many cases. The thing that I enjoyed about the community medicine that I was doing before is there were patients that had been with me for 10 to 15 years, and we bonded very closely. Whereas here, I'll see a patient for maybe a few weeks at most, and then they're sent to another hospital or a nursing home, or they're discharged. In most cases, never to be seen again. So there is that clinician-patient connection that I kind of miss, but in terms of knowledge base with hospitalist medicine, as compared to the community medicine that I was doing before, I find that you have to have a very, very broad base of knowledge when it comes to your group of patients. So I've really dealt more with internal medicine. So that's adult patients. I don't do peds. With this particular demographic, most of them are status post myocardial infarction, CVA, so cerebral vascular accidents, some gunshot, status post gunshot wounds, status post motor vehicle accidents, and sometimes sepsis, osteomyelitis. So kind of a whole array of things. Respiratory failure. With an admitting diagnosis, there's a whole array of comorbidities. So maybe the person is they've got osteomyelitis because of a diabetic foot ulcer, but they also have hypertension, hyperlipidemia, peripheral vascular disease. They may have chronic kidney failure from diabetic nephropathy. So I really have to know my pathophysiology and patient management of these diseases. And this is where I think one of you all asked me once, one of you all being my viewers, what was the most important course in PA school? Well, when it comes to hospitalist medicine, I would say all of them, because you have to know everything. I have to know my pathophysiology. I have to know my clinical chemistry. Certainly, at the basis of all that is your anatomy and physiology. You have to be a very good clinician, a very good detective. That's what I really enjoy about it. So how are you going to? We don't cure diseases. When you're a hospitalist, that's usually the job of the person's primary care specialist. So I'll backtrack a little bit. What a hospitalist does is, if a person is hospitalized for any reason, and they have to go to a hospital for long-term kind of, I don't know what's the word I'm looking for. So for long-term treatment. So whether that's, they've got to have respiratory therapy or something like that, or be in physical therapy. We hospitalists kind of take over the person's care from the primary care provider. because the primary care provider may not have privileges at that particular hospital. Sometimes we consult with the person's primary care provider to let them know how the patient's doing. We have to consult specialists who have privileges at our hospital. So maybe a person is there for, a diabetic foot ulcer, but then they also have got, CHF, so congestive heart failure, and they may need something. So we would consult with the cardiologist. Maybe they also have depression, so we consult with our psychiatrist. And that requires that you've got very good communication skills. You have to know when to obtain a consult. You've got to be a good listener of the patient and their families, a very good health educator. I do have a doctorate in health education, so I think that helps make me a better PA hospitalist. More about hospitalists. You really have to dot your I's and cross your proverbial T's. We get inspected by the Department of Health, as you do in outpatient clinics. But here, I find that it's a bit more intense. Hospitalists tend to be on the higher pay scale for PAs. So typically, a typical starting salary, straight out of school, might be about $100,000. For an experienced PA, that can go as high as $160,000. That doesn't include things like bonuses, whether it's a quarterly or a sign-on bonus. So it's an up and coming position. You can Google it and read about it. There's quite a number of doctors that are hospitalists, but there's not that many of them, relative to other specialties like cardiology, psychiatry, emergency medicine. And there's also since some residents have in some cases been able to truncate the astronomical amount of hours that they were forced to work for a pittance of pay. You don't have too many MDs around in working as hospitalists. So it's a good niche for physician assistants, as well as some nurse practitioners who may be interested in it. So you can, I'll put a link in the description so you can go to the professional organization. It's like the American Association of Hospitalist Medicine, and learn more about it. But it's something that you may want to consider. You have to be a voracious reader in order to be a good hospitalist. So my colleagues, other PA colleagues, and I are constantly reading journals. We watch videos. You should become fairly proficient at certain procedures: intubation, line placement, like PICC lines, central lines, midlines, femoral lines, because there may not be a line team, a line access team at the hospital where you work. There may not even be a phlebotomist. It depends on where you're working. But procedures and really having a good knowledge of patient management and disease management. So common diseases, and know when to call upon the consults, the specialists, and certainly know when to call your supervising physician. But sorry for rambling. I've had a very long day. I'm tired, and it's snowing outside. So I'm hoping to get home safely, inshallah, God willing. But I'd invite you guys to check out more of my videos if you have an interest in becoming a physician assistant. I've got some good tips on how to get into PA school and how to get through PA school and establish yourself in your career. I used to be a PA professor many years ago, and I've also interviewed other of my non-PA colleagues. But I wish you guys the best of success in your positive endeavors. Take care. Peace.